I'm John Batchelor, Larry Kudlow, CNBC, and Kudlow Radio on the weekend, and we turn to the Affordable Care Act after the Supreme Court, after King v. Burwell pushed aside the objection that the language of the Affordable Care Act is unsuccessful. That's pushed aside now. The Affordable Care Act is here, and what is to be done? The insurers have indicated anecdotally that rates are rising in all the states, some more severe than others, and we all know that in 2017 there is the expectation that the U.S. government will no longer subsidize, I don't know what's a correct word, risk corridor, the insurers, and so they also will suffer rate increase necessities because the government is not subsidizing them or providing for them the shortfall as they give out health care under market prices. Dr. Scott Atlas of the Hoover Institution joins us. The Dr. Atlas has written most recently at the Wall Street Journal about what is to be done, how to repair the Affordable Care Act now that the Supreme Court is out of the way. Dr. Atlas, a very good evening to you, and I want to begin with news of the moment. Hillary Clinton was speaking in these last hours about her expectations as president and what she will do for the Affordable Care Act, along with other policies. She says she is thrilled by the Supreme Court upholding the Affordable Care Act. So she's looking to stop the Republicans unraveling it in 2017. And this quote, "If a Republican is elected president, that will be the end of the Affordable Care Act. We have to succeed President Obama with a Democrat to protect, defend, and fix the Affordable Care Act." There, Scott, you and Hillary on the same page. You're both looking to fix it. Good evening to you.
And good evening to you, John.
Fix it how, Scott, or in Mrs. Clinton's mind, protect, defend, and fix the Affordable Care Act?
Well, I mean, her dream scenario, of course, is not only keeping the Affordable Care Act, but keeping the reforms, and she ran on very similar reforms when she was running last time, so it's no surprise that she supports it. The irony of the whole recent Supreme Court decision, though, is kind of has been lost in the discussion. The irony is the Supreme Court upheld the subsidies for private insurance. The irony of it is that it is the growing government centralization of insurance rather than private insurance that's the biggest problem, the most damaging to Americans.
Okay, one of the big takeaways from your article, to me at least, is that the onerous regulations and mandates inside the Obamacare plan, you can't just buy a simple catastrophic with a high deductible, for example, which is what a lot of young people would have preferred. And you have all these bells and whistles inside these plans, so the cost has gone sky high, and that is, you're saying that needs to be turned around. Is that right? In other words, to get back to a private system, we've got to deregulate this whole Obamacare and maybe start over again.
Well, I think what people don't understand is that it's private health insurance that correlates with better access and better quality of medical care. And so everything should be done to minimize people on government insurance, and reforms should be pushing people toward private insurance. The problem with the law is that they made many things, including, importantly, the things that you just mentioned, the mandated benefits, have made private insurance unaffordable to many, and increasingly so until it becomes unaffordable to anyone who's not very affluent. And you know, the fact is that when we see already evidence of Medicaid insurance, a big part of the Obamacare expansion of insurability, really doesn't correlate to access to medical care. So you're labeling people as insured, but more than 55% of doctors in major metropolitan areas don't take new Medicaid patients. And the same thing is happening with Medicare. I mean, 25-30% of Medicare beneficiaries now have a problem getting a doctor, new Medicare beneficiaries, at the exact time when, of course, the population is aging. So along with the expansion of Medicaid, the aging of the population, there's a massive increase in people anticipated to be depending on government insurance that isn't accepted. Secondly, government insurance has worse patient outcomes than for similar patients on private insurance. And isn't the goal to not just label people as insured, but to get them access to doctors and hospitals and to get them good medical care? So, you know, the unaffordability of private insurance is probably the most damaging part of the Affordable Care Act.
You mentioned, to add to Larry's question about mandates, you mentioned that there are unproven treatments here by chiropractors. There are also acupuncture and other remedies that aren't necessarily advised or wouldn't be chosen by a private citizen if there was private insurance. And do I read this correctly, Doctor, that it's increased prices by as much as 10%, these services?
Well, what's happened is that the estimates from looking at a variety of studies is that the combination of the minimum essential benefits, which is the name of the mandated coverage under Obamacare, and the state has, yes, increased prices by as much as 10%. But in addition, what we have seen, even pre-Obamacare, because this mandate expansion has really begun far, before Obamacare. Now there are over 2,000 mandated coverages in the states. And this is the kind of stuff that is really ridiculous and really anti-consumer. You're forcing people to buy everything from acupuncture to marriage therapy coverage, in vitro fertilization for people who are 55 years old, chiropractor care is one of the unproven treatments that you mentioned. All of these things add up to, in some studies, up to 50% of the cost of insurance. So when you add all these mandates up, and these are mandates that people don't want, you have forced people to buy an loaded insurance policy that they really can't even afford.
And that's why they need the subsidies. Is that correct, Scott?
That's exactly what I was going to say, was that that's another kind of irony of the whole thing. The Republicans and a lot of the media talked about what would happen if the Supreme Court ruled against the legality of the subsidies. And the answer is, get rid of the things that cause the subsidies to be necessary. That means these mandates. It bloated the price of private insurance to the point where people can't afford it without the subsidies. So, I mean, the whole thing is just such a poorly written and poorly conceived law.
Right. I mean, I don't need mammograms. I don't need lactation services. Okay, I have other needs. Some people who need them should go out and buy a policy that has them. But it seems to me one of the key issues here, Scott, is that the younger millennials who were supposed to buy the Obamacare packages in great volume in order to essentially subsidize the elderly and those who are sicker, they're not buying them because they're too expensive.
85% are subsidized, Larry. That was the number we were given before King v. Burwell.
I mean, that's just, Scott, that right there, it's people would rather pay the penalty than buy these Obamacare packages because they're so expensive.
Yes, and not only that, but you can get out of the penalty with an enormous number of loopholes. But you're right. I mean, the whole idea here is really kind of illustrating the principal point of one of the things that I and others like me write, which is that let's have the consumers decide what to spend their money on. First of all, that's fair, and second of all, that's how the prices come down in a competitive market where consumers are shopping for things. That's why computers have plummeted in price since they came out. That's why even non-covered medical procedures go down in price. When people pay out of pocket for them, the prices come down. And there are, the government should be. I mean, here's the fundamental point. Here is really also this, and that is that insurance has evolved into something it was never intended to be. Instead of insurance protecting from significant, unexpected, high expenses, health insurance has evolved to paying almost all of your charges. And so you have the illusion that it's free. And so therefore there's no value-based decision being made on buying health care at all.
And just one other point. In terms of the private option, you write about this, and I want to go. Medicaid, which is totally 100% government-run, doctors are fleeing Medicaid. But on top of that, Scott, and this is where I'd like you to go, Medicare is becoming increasingly government-run. Even Medicare Advantage is being cut back. And doctors are walking away. Private doctors, the top specialist-type doctors, Scott Alice, are walking away from Medicare also.
That's right. More than 20, this is back just at the beginning of Obamacare, more than 20% of primary care doctors refuse to see any new Medicare patients. Not just Medicaid, Medicare. In some states, more than half of doctors already don't accept new Medicare patients. And you're right, the CMS reports almost 10,000 doctors have completely opted out of Medicare, and that's tripled since 2009. So there's a real problem here people want to ignore. And, that's obviously not the appropriate way to proceed here. So, Hillary Clinton may want the law to be maintained, but that's not what's good for health care and for access to care for Americans.
Scott, was I speaking correctly that in 2017, when the risk corridors go away, the insurance companies all will raise their rates or need to in order to make up the gap?
Yes, and this is also the case for the something like $90 billion health insurance tax on insurers. Who do you think pays these things? They're all passed on to the consumers.
This is why, it's already happening, John. It's already happening. This is why these premiums are sky high.
Right.
And, Scott, what I think is most regrettable here is you're now seeing a wave of takeovers in the healthcare insurance business. And that means competition is going to be diminished. You're looking at oligopolies and, in some states, monopolies, which is less competitive, and that means higher premiums.
Absolutely correct. That merger kind of forcing companies to merge, or at least facilitating the environment that would make them want to merge is really detrimental to competition. And the choices are clearly documented. There's something like 21% less number of participating health insurance exchange companies in the previous year since the implementation of Obamacare. There's far less choice of coverage in rural America. Has almost no choice except for one or maybe two coverage options. So, the competition amongst insurers is dramatically reduced directly because of the law, which had promised to increase competition.
Scott Atlas, Dr. Scott Atlas, is a physician, and he's a senior fellow at Hoover Institution at Stanford University campus, writing most recently at the Wall Street Journal about after King v. Burwell. Larry Kudlow, CNBC, and Kudlow Radio on the Weekend. I'm John Batchelor.